Hi everyone and welcome back to my channel. And today I am going to be reviewing new drugs that I find in my practice. And I want to cover diabetic medications, and this group is called the sodium glucose transporter protein 2 inhibitor. And for short, we will call it the SGLT2 inhibitors. So I'm focusing on three of these medications today. So if you want to learn more about this class of medication, keep watching this video. Thank you. There are three different drugs in this class, and they include Forxiga, which is dapagliflozin, and that's available as a tablet with 5 milligram strength. Then there is Jardiance, which is empagliflozin, and that's also a tablet. It's available as 10 milligrams and 25 milligrams. Then there is Invokana, which is canagliflozin, and that's available as 100 milligrams and 300 milligram tablets. So what's the indication for the SGLT2 inhibitors? They're basically used along with diet and exercise to improve the blood glucose levels in adults with type 2 diabetes, and they can be combined with metformin, the sulfonylureas, the pioglitazones, the linagliptins, or basal or prandial insulin. So they basically can be combined with other diabetic medications in type 2 diabetic patients to better control their blood sugars. Okay, so this group, the mechanism of action is they work in the kidneys, and what they do is usually this protein allows the kidneys to reabsorb glucose. So because it inhibits this mechanism, it will prevent the body from reuptaking glucose and getting it back into the bloodstream. So what essentially happens is that your body will flush out all that extra glucose that is not reabsorbed by the kidneys. So that is the mechanism of action for this group of medication. So that's what we would simplify it for the patient and say it helps you to pee out your sugars or glucose. Okay, so some of the most common side effects of SGLT2 inhibitors are they can cause genital infection or yeast infection, and this is more common in females because we're more prone to yeast infection and because of the anatomy of the vagina. So patients will complain of a yeast infection if they're taking this group of medication because you're peeing out the extra sugars, they're going into your urine and getting into the vaginal area. So this will encourage the growth of yeast, and hence they will present with itchiness and the classic symptoms of yeast infection. So for these patients, you can recommend Canesten or topical antifungals, and that should help. But if it's a severe situation, then they should speak to their family doctors to get some more effective treatment. Increased urination is also a side effect. So because of the mechanism of the SGLT2 inhibitors, you're flushing the glucose from the body, so your kidneys will essentially let you go to the washroom more frequently. There will also be incidents of increased thirst. So I usually recommend that patient drink adequate water. So we normally say 8 glasses of water, but whatever water intake that they can increase would be recommended to help to keep them from being dehydrated and to also flush away the extra glucose that is being excreted from the body. Patients may also have concerns about orthostatic hypotension, And this is essentially where when you're sitting and you get up suddenly, your blood pressure will fall and you might feel dizzy. And this is the changing from position and causing your blood pressure to get lower. So this is orthostatic hypotension, and this is usually common in the elderly. So elderly patients that are 75 and older who are taking this type of medication may complain of orthostatic hypotension. If their kidney function is less than the glomerular filtration rate is less than 60 mils per minute, or if they're taking loop diuretics or other hypertensive medications, they may also complain of this side effect. So if any of these side effects are severe, they must be discussed with the family doctor. Okay, so there are some severe side effects that patients may experience when they're taking this group of medication, and this includes acute kidney infection. So if there is any sign of blood in the urine, or if there's fever, there's foul smelling urine or lower back pain, these would indicate that there is a kidney infection that's occurring, and this is considered a medical emergency. They should report this to their doctor or go to the emergency room. Also, patients who experience diabetic ketoacidosis, they may notice increased levels of ketones in the urine. So if you do like a urine test, you can use this ketone strips to notice this. More pronounced side effects can be like a sweet metallic taste in the mouth. They may be very thirsty and unusually tired or sleepy. And some patients may also go into a coma because there is just increased levels of sugars floating around in the body at this time. So this is a medical emergency, and patients who experience these symptoms should report to the doctor or to the emergency room to get medical help as soon as these symptoms occur. So these are just some of the serious side effects from taking the group of medication SGLT2 inhibitors. There are several benefits to taking the SGLT2 inhibitors, and this can include lowering the blood glucose or improving your A1C levels, and that is just based on how the drug works. You're peeing out your extra sugars or extra glucose, so this will definitely lower your blood glucose levels. Weight loss is also a benefit of taking this group of medications. So patient may notice a reduction of 1 to 4 kilograms over a 3 month period or more. There's also a reduction in blood pressure. So patient will notice that both their systolic and diastolic blood pressures are reduced somewhat. And then there is the cardiovascular benefit that is a great thing for that they promote a lot, especially with the Jardians. So these are just some of the benefits of getting this type of medication. And another great thing about these, they're usually once daily. For the most part, they're given once daily. So in terms of compliance, patients usually are more compliant if they're taking their medication once daily, and then they can go about their daily life. Okay. So there are several contraindications in taking the SGLT2 inhibitors, and these include type 1 diabetes, or if you have diabetic ketoacidosis, which we had mentioned earlier when we were looking at severe side effects. If you have severe kidney disease, wherein the mechanism of the drug is to flush the sugars from the body. So if your kidneys aren't working well, then it would not be a good drug to take. For severe liver disease, we don't recommend this type of medication. If you're pregnant or planning to become pregnant, then we wouldn't recommend taking this group of medication. Breastfeeding mothers and allergic to any of the ingredients found in any of this class of medication. If you have any allergies to these, then you would not take this medication. Okay, guys, so that's it for today. I have reviewed this special group of diabetic medication, the SGLT2 inhibitors, and they are doing very well on the market right now, and they are available in Canada, so you can speak to your doctors and see how that can benefit you. And for students, this is something that you can look more into if you're looking for something that's new on the market that you want to study more about. This is a new diabetic class of medication. So this is Carrie and the chemist coming to you and just giving you some informative health videos today. So please enjoy and remember to like, subscribe, and comment on the video. If you like this format of a presentation and new to this type, I usually just do videos. So I'm just incorporating PowerPoint with my videos, so it's more engaging. So if you like it this way, you can let me know in the comments below, and I will do more of these videos for you. Okay, guys, thank you. Bye.